Solving problems in breast cancer really can't be done by just one type of expertise.
We have a kind of overlapping but distinct interests and expertise on breast cancer.
And there's so many aspects of research. One could be working on prevention, one could be working on genetics or early detection.
We need to have the laboratory facilities, we need to have the patients participating in the research.
Everybody wants the solutions right away.
There's somewhere around 30 different mutations driving every single breast cancer.
One has to understand all of the aspects of what causes the disease, what makes it grow and what makes it kill people.
Life is incredibly complicated, and it's taking us a long time to understand that complexity. But we've made a lot of progress. We just don't know how much farther we have to go.
In this next phase of cancer research, I think we're seeing an increasing emphasis on trying to understand the factors that affect quality of life of breast cancer survivors.
We need to think about the patient as a whole and their family. It's not only dealing with the disease itself.
It's not just lab research you're doing. It's not just cells on a plate.
It is patients that are bringing us ideas. You know, if you listen to your patient, they have needs. You would ask a doctor, he would say, I want to cure breast cancer. Ask a patient, they will say, I want you to care about my cancer.
We want to have a best fit for a given patient, for any individual woman with breast cancer. What is the treatment that will be most effective for her, and what treatments will not be necessary?
We are able to take women who have been diagnosed with very early stage breast cancer and submit their tumors for very specific molecular testing to determine whether that woman will actually benefit from chemotherapy or whether she requires chemotherapy.
Because we want to save people's lives.
We've identified mammographic density as being one of the strongest known risk factors for the disease. We've identified that most of the variation in mammographic density that we see in the population is likely to be genetic.
We have invented a new technique that involves insertion of radioactive seeds into the breast after the surgery has been done to prevent a recurrence. So the treatment takes about an hour, and the patient can take her treatment home and don't have to come every day to the hospital.
We can do a lot of the surgeries that we used to use as inpatients stays now we can do as outpatients.
What I can see in the future is
a simple blood test that will be able to identify breast cancer in a woman.
Identifying molecular signatures that can be found in breast tumors.
We will understand what genes are affected in an individual.
Targeting therapies for individual patients.
Mixtures of drugs that will kill an individual tumor.
Clear up any residual breast cancer cells that are still present in the body following surgery.
We could treat them exclusively with the seeds. The benefit will be just 1 hour treatment.
Stents for lymphatic vessels.
As it pains me as a surgeon to say, I would love to see surgery not have to be done anymore for breast cancer.
Make breast cancer a disease which women no longer need to fear.
We don't see it as something that we just have to live with. It's something we can fight against, it's something that we can conquer.